Good morning, Penny. My name's Philippa. I'm going to examine your ankle and your foot today, if that's okay. Are you sitting comfortably? Lovely. And I've noticed as you're walking in, you were limping on your left foot. Is that correct? Lovely. Right. If you don't mind, I'm going to have a little look, have a little feel, and then get you to do some movements, if that's all right. So first of all, Penny, I'm just going to have a look at your ankle. I'm going to note any obvious bruising, any swelling, any scars, any wounds, any muscle wastage. And as we said before, you were limping on that leg. And I'm just going to have a little feel of the temperature of both of your ankles, if that's all right. I'm just going to compare the temperature on both ankles. Also going to feel your pulses. So I'm going to feel the dorsalis pedis pulse and your tibial, posterior tibial pulse just there. I'm just going to squeeze across your metacarpals, metatarsals for any pain. And going to feel for your medial malleolus, your lateral malleolus, and any pain in the ankle joint. I'm also going to feel for the fifth metatarsal if there's any pain, and the navicular. I'm also going to have a look at each individual bone. Just tell me when you have any pain in those bones. I'm also going to palpate the Achilles tendon for any pain. Penny, is it okay if you could flex your ankle for me? So dorsiflexion and plantar flexion. Lovely. Are you able to move your ankle inwards, inversion, and out, eversion, and just flex those toes and extend them as well? Lovely. If you're not able to do those movements, I will passively do those movements for you as well, if you can manage. I will also make sure I examine the knee, any pain in the patella, behind the knee, in the medial and lateral collateral ligaments. And I would just test sensation. Can you feel that okay? I'll also have a look at the tibia, any pain in the tibia, fibula head, proximal fibula and distal fibula, any pain there. Would you like any pain relief, Penny? Fine. Obviously, if your leg was noticeably blue, there was some skin integrity, as in it looked like you need manipulating. I would make sure that gets done first before we do anything, to help with the blood supply and get that fracture site back in place. Once we've x-rays and we've established a fracture, I would probably put you in a back slab, below knee back slab, and obviously re-x-ray the site to make sure it's in the right position. Obviously, I've come to the conclusion you may need an x-ray because of the Ottawa ankle and foot rules. So the Ottawa ankle rules state that if you are tender on the posterior edge of the lateral malleolus, or the medial malleolus, and you're unable to weight bear, I can x-ray. And with the foot rules, if you're tender in navicular, the base of the fifth, unable to weight bear, I would also x-ray you. There you go.